This is something that we need to understand very carefully. So cholesterol by itself is not a bad thing. Smoking is the most important cause of heart disease. So this is something absolutely modifiable. So no tobacco, no smoking should be a strategy to prevent heart disease. It's the commonest prescribed medicine in the entire world are a class of drugs called statins. LDL should be less than 100 milligram per deciliter for everyone.
Okay.
All Indians should have it less than 100. That's the bad cholesterol we are talking about. I don't think we should now start dividing the world between those who are obese and those who are not obese. Fats circulate in the human circulation. And that is how it reaches the various aspects of our human body. One of the identifiable factors of coronary artery disease, that means the blockages of blood vessels in the human heart, LDL cholesterol plays a very important part. Let me also insist on this, that amongst the known identifiable factors of human heart diseases and heart attacks is LDL cholesterol. You can be a perfect vegetarian and yet have a heart attack in this country.
हर इंडियन फैमिली में तो ये सुना ही होगा कि कोलेस्ट्रॉल हाई है, या आप भी ऑयली फूड या फ्राइड फूड खा के गिल्ट ट्रिप पे चले जाते हैं. डिड यू नो दैट यू डोंट नीड टू किल योर क्रेविंग्स टू स्टे हेल्दी? ऑल यू हैव टू डू इज बैलेंस देम आउट. दिस इज एग्जैक्टली व्हाट द पॉडकास्ट इज अबाउट. नमस्ते एंड वेलकम एवरीवन टू अनदर एपिसोड ऑफ बियॉन्ड द पिल, वेयर health meets conversation. I am your host, Dr. Chetna. Today we are diving into a topic that's often confusing but super important for our health: lipids. Now, the word lipids might sound fancy, but it is just another medical term for fats. So buckle up as we get to the lowdown on good fat, bad fat, and everything in between. Let's bust some myths and empower you to make informed choices for your heart health. Joining us today is Dr. Uday Jadhav, a renowned cardiologist of India who holds a vast experience in the field of cardiology and non-communicable disease. Today he will be sharing his expertise by helping us understand the depth of cholesterol and burst some myth about the same. To start off, sir, are lipids and fats same? Can you please tell our viewers about it?
So thank you, Dr. Chetna, for this opportunity to talk to our community, and thank you for a very important question. By itself, it looks complex, but let us understand, when a patient goes to get his lipid profile done, that's the word we use in laboratories, the lipid profile will estimate something called lipoproteins. So that's lipids and proteins. That's the way the fats circulate in the human circulation. And that is how it reaches the various aspects of our human body. So if you typically look at the lipid profile, which the labs report, you will see, Dr. Chetna, there will be a total cholesterol, a LDL cholesterol, HDL cholesterol, triglycerides, very low density lipoprotein. So when we say low density lipoproteins, these are components of fats, which will have a different density. So the size and the density of that fat determines how these fats are going to circulate in the human system.
Okay, so sir, majority of the population knows cholesterol as good cholesterol and bad cholesterol. So what's your take about it?
Absolutely. So the simplistic way of putting it is the LDL cholesterol, low density cholesterol, is the bad cholesterol.
Okay.
And the high density cholesterol is the good or the better cholesterol. The reason being, LDL cholesterol is the excess cholesterol that will circulate once it is utilized by our human cells. And whatever is then removed back, it's like a plumbing job. Whatever is the bad cholesterols, they will be removed by the HDL cholesterol and then excreted through the human system.
So according to you, what are the important reasons that causes increase in the lipid levels?
This is something that we need to understand very carefully. All components, whether it's fats or proteins, everything has to come eventually partly from the diet, but there is a synthesis also.
Okay.
So let's talk of cholesterol as a whole substance by itself. Why is cholesterol important? Cholesterol is important to maintain the integrity of the human cell membrane. It also is important for production of steroids. These steroids leads to various functions of our human system. The brain requires it, the reproductive system requires it. So cholesterol by itself is not a bad thing. It is when the production becomes excessive that we start looking at the risk which is conferred on a particular individual.
Okay, so earlier you mentioned about lipoproteins, LDL, HDL, those are the subtypes. Like, are these the categories of cholesterol, or so can you just brief it about?
Yeah, so all these are categories of the lipid profiles that are done. What is the most important understanding amongst all these? LDL cholesterol comes from our diet, let's say, or triglycerides comes from our diet, what you eat. Every fraction of the lipid profiles or every fractions of the cholesterol, part of it comes from the human diet.
Okay.
A significant part gets newly produced from the liver or from the intestine. That's the process of synthesis, new production. And this is something which is not in our hands. Now, as we know in modern science, diet, of course, is easy to understand, right? We talk about how we eat, what are the saturated fats we eat, what are the good things we eat, what are the trash foods we eat, what are the processed and unprocessed food we eat. But the synthesis part is determined by the human genetic system. So the way genes express in the human system decides how much cholesterol is produced by the liver and the intestine. LDL cholesterol is synthesized by a receptor on the liver. So there are LDL receptors. The function of these LDL receptors are not really controllable by us as human beings. It's something that our genes decide. So if there is a LDL receptor anomaly, Dr. Chetna, that will lead to excessive LDL production, which we cannot have a control over. And therefore, we must understand this, that diet is extremely important, will part of the human cholesterol. But there is another part which is also to be paid attention to, and that part of the cholesterol, if unchecked, leads to heart diseases, paralytic strokes, thickening of the arteries of the legs, called as the peripheral arterial disease, multiple complications.
Okay, so can you tell me that if my report shows high cholesterol level, is it life-threatening, or am I at risk of having any coronary artery disease or heart attack?
Very good question. I guess by this time we know, both in terms of science and we know how we have all talked about it, that one of the identifiable factors of coronary artery disease, that means the blockages of blood vessels in the human heart, LDL cholesterol plays a very important part. It's the bad cholesterol. So what circulates in the blood is also likely to get deposited in the vessel wall. So if they get deposited in the blood vessel wall, they'll thicken the artery. Over a period of time, if it goes unchecked, that would lead to heart attacks. This is a very identifiable factor. Let me also insist on this, that amongst the known identifiable factors of human heart diseases and heart attacks is LDL cholesterol.
Okay.
There are other things. There could be family histories, there could be modifiable risk factors, and let me not undermine this to the entire discussion that we are having. Smoking is the most important cause of heart disease. So this is something absolutely modifiable. So no tobacco, no smoking should be a strategy to prevent heart disease.
So smoking is also one of a risk factor.
Oh, absolutely. Absolutely. In fact, I would say it's a prime risk factor.
How often should I check my lipid profile? Once a month or once a year is also okay?
I believe all adolescents above the age of 18 years must get their lipid profile done as a baseline, considering that our Asian ethnicity, that means the Indians inclusive, have a much higher incidence of heart disease than the rest of the world. And therefore, all adolescents above 18 must check it up. If it is high, then diet and exercises come, or lifestyle modifications as we call it, comes first into place. Based on how responsive it is, you may do it once in 6 months or once in a year. If a patient requires a medicine for treating high cholesterol and the commonest prescribed across the globe, let me tell you, it's the commonest prescribed medicine in the entire world are a class of drugs called statins. And if a patient is on a statin or a cholesterol lowering medication, then it may become mandatory to check it not later than 6 months, I would say. I mean, 4 months is okay, but I will say looking at the cost effectivity, once in 6 months is fair.
Would my body show any sign and symptoms of high cholesterol?
That's what is troubling the entire science as of now, that here is one problem that may not necessarily have any symptoms or any signs. Let's say acceptable bad cholesterol or LDL cholesterol should be less than 100, and somebody has a cholesterol of 150 or 160 may still not have any symptoms at all. But what it creates and causes tremendous consequences in terms of heart disease and paralysis. So when the event happens and you check, you actually identify. But yes, there are genetic hypercholesterolemia, means high cholesterols because of families inheriting it from generations, from father to sons, or depending upon the pattern of inheritance. They may have some signs. Let me tell you, one common sign is you often see just below the eyes yellow streaks of fat getting deposited. That's called xanthelasma in medical terminology. It's simple. Excess of fat may get deposited and may be seen like xanthelasma, sometimes on the muscle endings, the tendons. Sometimes it can get reflected in the fat that it gets accumulated in the liver. We call it fatty liver. So there are ways, but then mostly it's without symptoms.
Without symptoms. All right. And what do you think is the optimal value that we can maintain, lipid level value?
Right, so that's called lipid for good health. Lipid for good health. I believe if we look at the entire data from our country and Asian subcontinent, and also having participated on this sort of research in India, LDL should be less than 100 milligram per deciliter for everyone.
Okay.
All Indians should have it less than 100. That's the bad cholesterol we are talking about. Those who have some level of risk factors like smoking, like blood pressure, diabetes, try and get it less than 70. Those who have suffered from heart attacks, we try and aim between 30 to 50 milligrams. The other one is called triglycerides, and those are better maintained. We call it as the metabolic parameter of good health. Triglycerides is like the cream floating over the milk, right? So they are made of something called chylomicrons, and they are better kept below 200, preferred less than 150. HDL, the good cholesterol, is always a challenge because in today's date you don't have medicines to increase the HDL cholesterol. So HDL cholesterol, a little more the better. General acceptable range is 40 to 60 for reasonable good health. One may achieve that with good exercises.
Okay, so doctor, we know that mostly cholesterol is being observed in population who have obesity or are overweight. What do you think? Even a fit person may also have high lipid levels?
Oh, absolutely. I don't think we should now start dividing the world between those who are obese and those who are not obese in terms of all these risk factors. Non-obese will also have very high cholesterol. So the parameter of obesity should not be the deciding factor whether you do your lipid profile or you don't do your lipid profile. It's there in both obese and non-obese.
What I have understood is that diet plays an important role in maintaining the cholesterol level. So sometimes in some food products, it is mentioned that it is zero fat. So what do you think? Is that a heart healthy food?
Oh, yes. I think so. The way science has looked at it has always a challenge about traditional thinking and traditional wisdom, because we believe that some of our food items could be good or bad. Science have been able to resolve some of those issues, not all, because you cannot have a clinical trial study based on entire dietary components. But simple things are this. You have high cholesterol in a food item, you can have high saturated fats in a given item. Let's talk about egg, making it very simple. I'm just quoting one example because this is always what patients ask and the community wants to know. So egg has 186 milligrams of cholesterol. The saturated fat could be 4, right? You look at a toned milk. The toned milk still has a cholesterol of about 20 or 23 milligrams, and it also has a saturated fat which could be as much as egg, 3 or 4 milligrams. So you have to look at a balance. between food which contains a high cholesterol and food which contains a saturated fat. Please remember that cholesterol is there in the animal cell membrane. So necessarily it has to come from animal cell products. That's why world over we say don't eat too much of a non-vegetarian food which is rich in meats, because it will bring in extra cholesterol. But here is something that the Indian community should learn. It doesn't stop at vegetarian and non-vegetarian. You can be a perfect vegetarian and yet have a heart attack in this country. In the dietary component, that comes from how much is the saturated fat you consume, right? So if you're going to fry everything or you add excess oil to your food, you may not have any cholesterol in the plant products or the plant kingdom, but once you add your saturated fat, it's all the same. Risk is the same.
So, sir, because you have been using saturated and unsaturated terms a lot, just for our viewers, can you tell us what exactly are saturated fats and unsaturated fats?
So all fats are considered bad, but there are fats which are helpful also. So depending upon the what shall we say, the structure of the fat, that's called as the structure of the molecule. Fats are split into polyunsaturated, monounsaturated. Let me give you simple examples because that typically comes from eating oils. So when you consume a high fat ghee, let us say, which is traditional in India, that will have a lot of saturated fats. It's a thick fat component. There are oils which may be having a higher polyunsaturated fatty acid, let's say coconut oil, thicker oil. There are oils which are high in their complex of the molecule, which are monounsaturated. For example, let's say olive oil, or even some of the oils consumed traditionally in our country, til, mustard. Some of these oils are monounsaturated and they do not create as much difficulty in terms of heart disease as compared to consuming fats which are fully saturated versus unsaturated. Simple. You have your milk, take the cream over it, it's saturated. You get the cream off, it's a little unsaturated fat.
So, Dr. Uday, can you tell us, whenever we are opting for a lipid profile testing, so one should be fasting or non-fasting?
I think this is one of the most important questions in today's discussion. Lipid profile का estimation fasting पे जरूरी नहीं है. It's not required. Please understand this. The reason being, when lipid profile is measured by laboratories over the last 30 or 40 years, it measures three cholesterols, the total, the HDL and the triglyceride, and that's the subtraction followed by some sort of formulation. That gives the value of the LDL cholesterol. It is the LDL cholesterol which is the target of how you should treat a patient. It is correlated with the risk. It is correlated with how you treat. So way back in 2008 came the first scientific indications and guidelines which started saying it's good to have non-fasting, one for a convenience. Okay. So one doesn't have to rush in the morning, first thing in the morning, to get on a fasting a lipid profile done. And let me explain the science to all our community members. That now the laboratories actually measure the LDL cholesterol. That's called as direct. तो आप जब lipid profile देखेंगे, bracket के अंदर लिखा हुआ रहेगा direct estimation. This direct estimation of LDL is very important because it is only food that can probably alter the LDL. The exact figure also I can tell you. If a LDL is done first thing in the morning, cholesterol, or it is done through the day, the difference is only 8 milligram %. It may be just 8 milligram higher. तो उससे रिस्क एस्टिमेट नहीं होता है. अब फास्टिंग करे या नॉन फास्टिंग करे उससे कोई फर्क नहीं पड़ता है. एंड दिस इज़ वेरी वाइटल फॉर अ पेशेंट्स ट्रीटमेंट. 10-12 घंटे का फास्टिंग बिल्कुल ही ज़रूरी नहीं है. और LDL का जो चेंजेस होते हैं दिन में कभी भी करो, इट इज़ बेस्ड ऑन वाटर इनटेक एंड लिक्विड इनटेक. फूड इनटेक से बहुत फ़र्क नहीं पड़ता है. सो ये सबसे इम्पॉर्टेंट बात है. दूसरी बात की जो ट्राइग्लिसराइड्स एस्टिमेट करते हैं, राइट, इसकी अंडरस्टैंडिंग बहुत ज़रूरी है कि ट्राइग्लिसराइड्स आप फर्स्ट थिंग इन द मॉर्निंग कीजिए 8 बजे, या आप दिन में कर लीजिए. The difference is about 26 milligrams. If triglycerides are checked after eating, it will go up by 26 milligrams. Unlike LDL cholesterol, which does not change, the post-meal, post-food triglycerides are more important for heart disease than the fasting ones. So ideally speaking, this should be done on a non-fasting stomach.
So can we get them checked separately, or they come under same profile?
No, it's not required to check separately. एक ही lipid profile में सब आ जाता है. When these fractions are not available, let us say, सबसे सिंपल टोटल कोलेस्ट्रॉल, अब टोटल कोलेस्ट्रॉल चेक कर लीजिए, 180 मिलीग्राम पर डेसीलीटर के नीचे रहा तो दैट्स वेरी गुड. और जो लेबोरेटरी की रेंज आप लोग पढ़ते हैं, लिखी हुई रहती है, जैसे LDL रेंज 100 to 160, 100 to 190, ये सही नहीं है. There is no range. It is based on the risk that an individual patient has. जिनको कोई तकलीफ नहीं है, उनके लिए 100 मिलीग्राम डेसीलीटर LDL is good. जिनको हार्ट डिजीज है, उनको 100 मिलीग्राम डेसीलीटर is pretty bad. I mean, they will have to have it less than 50 milligram per deciliter, right? So range, laboratory range is irrelevant. Risk is very important. Risk देख के आप डिसाइड कर लीजिए आपकी क्या रेंज होनी चाहिए.
So doctor, broadly speaking, what are the measures that can be taken to maintain the bad cholesterol? Not maintain, like how can we improve bad cholesterol?
So let us understand one important aspect for all of us, that triglycerides get better lowered with diet and exercises. In fact, they can, I would probably, if I am an exercise promoter, I would say you can get back everything to normalcy. What you eat or you don't eat. And let me talk of triglycerides only first, because triglycerides, simply putting, is like the cream floating over your milk products or your ice creams or wherever you look at it. These triglycerides can be lowered not necessarily by lowering the fried food and oily food. That's important, वो तो करना ही चाहिए. But it gets lowered by reducing the sugar content, the refined sugar in the diet. So not taking refined sugar, not adding extra sugar in the diet, taking care and avoiding things like cakes, pastries, sweets, sweetened ice creams, foods which are very rich in sugar content. I know it's the king of our country in terms of fruits, mangoes for example. The more richer fruit you eat or richer items you eat in carbohydrates, refined sugar, triglyceride बढ़ जाएगा. And I'm saying this to our entire listeners, viewers here, that please don't start a medicine for lowering triglyceride first. Please exercise and lower your sugar content and it will come down. LDL cholesterol, unfortunately, is not really that amenable or that responsive to diet. I'm not undermining the importance of diet. This is synthesized by the human system, by liver and intestine, therefore you may have to take a medicine based on your risk for certain. But what can we do in simplicity? Saturated fats कम कर दीजिए, oily fried food कम कर दीजिए, non-vegetarian diet items कम कर दीजिए, junk food कम कर दीजिए for sure. तो इसमें कौन सा बड़ा big science is there? जिनको this is called as the modest way of living, right? I mean, this is something we have learned over our centuries and generations. This is nothing new. Thousands of years we have known about this. What is it that one Dr. Chetna or Dr. Uday Jadhav can give you a very, what shall we say, rocket science about it? We must comply by it. It is not listening only to advice. It is not listening to our interaction here. It is compliance, following them in real life. That's what all is going to make a difference. So reduce all those components in diet. The other component is HDL cholesterol. How do we improve the good cholesterol? Now everyone wants their good cholesterol to go up, and when you reduce the bad cholesterol, the good cholesterol also comes up a little, because some of those restrictions, Dr. Chetna, which we keep for LDL cholesterol and triglycerides, have benefits on HDL cholesterol also. There are aspects in Indian diet which have recently been shown to have some improvement. For example, the American Heart Association released their position paper in Jan 2024 for some dietary advice, and some of the Indian items, for example, turmeric can help to some extent. There is some evidence on garlic, on ginger. Taking monounsaturated fatty acid rich oils like you have olive oils or you have til or mustard in this country. So, well, I think these are the aspects that will improve the HDL cholesterol. It's also good to eat little more plant-based diet, right? So the Indian diet, we are fortunate, really fortunate that if you, I mean, why is this generation going away from a good plant-based diet? There is no reason, right? We have it in plenty and it's very well cooked. So a plant-based diet, a little more nuts, like walnuts are good, almonds are good, handful are very good. Restriction of animal fats would help, and absolutely for sure, exercises improves the HDL cholesterol.
So earlier we only knew that carbohydrates and sugar dietary products are contraindicated food for only for high glucose level patients. But now even the population with a high lipid profile should avoid high carbs and high glucose food contents, right?
Oh, absolutely. I mean, look at it in a holistic way that human beings neither require extra sugar nor require any extra salt in diet. It's been taken care of by the natural ingredients. So we have evolved from the hunter-gatherers days to today, where those aspects were required for preservations. Those were the times of hardships and famines. Now is a time of plenty. When you have plenty, you must choose and pick, right? Dr. Chetna, I'm sure you agree with me. So that's how we are going to look at the lipid profile in a holistic way. And I'm making my final comments on it. Just to summarize this, that your lipid profile is as good non-fasting as fasting. Don't worry about it. If you don't have to take a leave or bunk your office to do a lipid profile, please don't do that. Second thing is that all components are important. If you put them all together, the bad and good, you want lesser of bad, better of the good cholesterols. That's lesser of LDL and triglycerides, VLDL, better of HDL cholesterol. A holistic approach to life with good dietary restrictions certainly go a long way in giving you a better lipid profile. Please don't look at lab range, look at your risk. Please estimate it right at the beginning if anyone is above the age of 18 years, and at least repeat it once in 6 months for those who are on treatment or need to repeat it, or at least once in a year, just to see where and what we can do in terms of preventing heart disease. Thank you very much. It's been a pleasure today.
Thank you, Dr. Uday, for your valuable insights. Thanks a lot. That was all about today's conversation on cholesterol. Now you can eat whatever you like guilt-free and indulge in your favorites, but always remember to maintain a balance. Thank you so much for joining us. We'll see you shortly with another episode all about health and well-being. Until then, stay informed, stay healthy.